Jen,
I'm
are you
choking over my
okay?
words here.
Oh, okay.
It's
I
an
was like,
emotional traffic
uh-oh.
report, you know? Yeah.
Respiratory season, cue Jen. Okay. Colds, flu, COVID-19, RSV, doesn't that sound fun? And kids, it's upticking basically with kids' cases here in the Valley. So we are talking with a doctor here, Dr. Bhavaraju from Phoenix Children's Hospital, about how parents can really keep their kids healthy and first off, identify what they have because you've got COVID-19, you've got the flu, you've got, a common cold. How do you even tell the difference between what's what? Because you've got options.
There are many, many to choose from off the menu. There are a whole host of viruses that can cause respiratory symptoms, and all of them have some similar features. The most common ones we see are the common cold, as you mentioned, flu, COVID, and RSV. And their features are similar, so sometimes it doesn't necessarily make a difference which one you have. The symptoms and the treatment are generally the same.
So when should I call the doctor? When should I be like, you know what? I think we need to go in.
Yeah, it's a great question. So a lot of the features that we'll see are fever, cough, congestion or runny nose, sore throat, some disinterest in eating and drinking, and feeling a little bit tired. Those are usually symptoms that can get better with time, but if you're starting to see that your child's just not getting better, their fever is quite high without coming down, they are having wheezing, difficulty breathing, they're just not acting like themselves, that's a time when you want to call the doctor. We always say that as a parent, you know your child best, and if it just seems like something's not right, pick up the phone and give a call.
So when should you kind of talked about the time that they're sick. Does it take like a week to get over this stuff, 5 days, 10 days? How do you know, like, okay, you should be better by now and you're not?
Yeah, it depends a little bit about the phase of the symptoms, but most times you get exposed to a virus, it could take 5 to 7 to 10 days for you to actually get those symptoms, and then another 5 or 7 days to recover from them. Once you sort of hit the peak and start getting better, they should be getting better daily. If they're not, or you start to see some new symptoms, that would be a time that you'd want to give the doctor a call.
When is it okay for them to be around other people as well?
Yeah, so all of these infections are spread through infected droplets, meaning you sneeze in your hands and then those infected droplets get to somebody else or through the air. So while they're still coughing and still sneezing and still having a runny nose, they're still infectious.
Okay, got it. So we're talking about prevention here. Obviously we've got wash your hands, all of that stuff, but what about as far as vaccines go?
Well, pediatricians and the medical community strongly believe that vaccines are safe, effective, and the best way to prevent your children from getting sick. The American Academy of Pediatrics recommends both the flu and the COVID vaccine for all children greater than 6 months of age. And the best time to get them is actually now. So each of these viruses, they change each year. So you do need to get a new vaccine each year. Best time is right before the respiratory season starts, so they can build that immunity and their bodies can be prepared in case they get infected.
And now is a good time because obviously you're going to be around a lot of people. Families probably coming in this week. They're coming from who knows where. They've been on planes. They're coming in. The same goes for Christmas now, that's right around the corner. So now, how long does it take for that to take effect?
So the reason why we call this respiratory season is exactly that. We've got people spending more time in close quarters. We've got families, big family gatherings. All of those can facilitate or help the spread of viruses from person to person. So the earlier you get that vaccine, the better. Now, with that said, if you miss that window, which is usually October, early November, it is never too late to get that vaccine. Any immunity is going to be better than none.
Can I get the flu vaccine and the COVID vaccine at the same time?
Yes, everyone's very busy and time is limited, and there's no reason you can't do them both at the same time. I say if you're gonna, when you make that decision to get that done, that's the time to do it.
Yeah, I was just telling the doctor before we came on, I got my flu shot a couple weeks ago. Didn't even know that I had it. Like I had no symptoms whatsoever. It was simple.
Yes.
I had the flu last season, and I was like, you know what? This ain't happening again this season, Emma. I was like, no, you know what? I almost ruined Christmas, or Christmas was ruined for me. Yeah, it was.
That's not right. Well, I'm glad that we got you better.
Thank you.